Welcome, everybody. This is an e-mental health in practice webinar. The e-mental health in practice project is a project funded by the Australian federal government to help people working in primary care, so that's GPs and everybody else working in primary care, to help them understand, get to know, understand, and work out how to use online resources, digital resources in their care of patients and clients with mental health conditions. You can see the logos of all the people involved in the presentation of this webinar at the bottom of the slide. There has been a lot of input into this webinar. This is webinar 44 in the Black Dog Institute's MPRAC series, and tonight we're going to be talking about supporting Indigenous wellbeing by using digital resources, where this will be an introduction for most of you to some new resources that we hope that you'll be able to go immediately into your practices and use with your patients. I'm Jan Orman. I'm GP Services Consultant at Black Dog Institute. I'm a GP and I'm one of the educators in the Black Dog Institute's professional education team and have been for quite some time. I write many of these webinars and deliver all of them as a facilitator, but tonight I haven't written this webinar. I've got some experts to write this webinar for me. Dave's one of the experts. Dave, would you like to do this acknowledgement of country?
Thanks, Jan. I will, and you get my gander up when you call me an expert, but thanks for the accolades. Listen, I'm David Edwards. I'm a Warramai man. My family are from the Kurua area, that's north of Newcastle in New South Wales, and I'm actually not on country tonight, so I'd like to acknowledge country, and I'd like to acknowledge the country I'm on through my native Guttung language that was given to me by my uncle Stephen Brereton. So, Guji Yigu, Minyang Yura Wobalin, Nia Yigu Marala Baragu, Yi, Wijibul Waibu Barai, Gatai Niran. And that translates to, look at all of us here, we come together. I'm on Wijibul Waibu country, and let us be together in this space. So I'd also like to acknowledge all the respective Aboriginal Torres Strait Islander country that everyone zooms in tonight, and also acknowledge the Indigenous mob that might be joining us tonight, as well as our non-Indigenous brothers and sisters, our clinicians out there that have joined us on this webinar. I'd also like to just give you a quick introduction about myself. I'm a co-director of the WellMob website project, which we'll talk about tonight, along with James Bennett-Levy, and my other colleagues, Judy Singer, who's on the end of the chat channel there and assisting me tonight, as well as our other team members, Taylor Laurie and Shani Roberts. And you'll hear from Shani later on with a pre-recorded demonstration of the WellMob website.
While we're doing the acknowledgements, can I acknowledge my friend Bronwyn Bancroft, who's given me permission to use her beautiful artwork. Bronwyn's from up there in northern New South Wales as well.
Yeah, thanks, Jen. I was going to mention that we're Wijibul Waibu countries in Lismore, New South Wales, which is in the heart of Bundjalung country. And our WellMob website team are actually based at the University Centre for Rural Health, which is a part of the University of Sydney, and also one of the collaborators of the Electronic Mental Health in Practice project.
So, who are these people?
Okay, the next slide there, Jan, is acknowledging all the deadly Aboriginal and Torres Strait Islander wellbeing workers that have actually contributed to the WellMob website and this whole project, and as to why we are here tonight. And starting in the top right there, we've got the one of the Bundjalung Aboriginal advisory groups that were actually the brains trust to come up with the idea of having a website that is first off in Australia to have a repository of Indigenous specific wellbeing resources. And then top left, we've got one of our 3 reference groups that were formed to actually guide us on this journey of developing the WellMob website. So we made sure it was going to have that Indigenous ownership and look and feel about it. And so our Lismore reference group there are top left. Bottom left, we've got our group down in Ghana country in Adelaide that was convened by Michelle Sweet, who's a Menzies School of Health researcher. And we managed to have a little group there at the South Australian Medical Health and Research Institute. And finally, bottom right, our last reference group up in Larrakia country in Darwin, that Trish Nagel helped us get together there with the Menzies School of Health. So a big shout out to all those reference groups that without them, this website would not be possible.
So we want you to participate in the webinar as much as possible, but we won't let you have a microphone and a camera. There are too many of you for that to happen. What we'd like you to do is talk to us through the chat box. If you open your chat box and go down to the drop-down menu at the bottom of the chat box, please set it to all panelists and attendees so that we can all take part in the discussion and hear what you have to say. Please use that chat box with the same respect you would if you were in the room with somebody. Also, we've got a couple of polls so we can find out a little bit about you, about what kind of practices you have, and what your experience with Indigenous clients and patients might be. And at the end of the webinar, we've got a feedback form. We're doing some assessment of the webinars, and we'd like to know how we can make these webinars better experiences for you, if at all. The learning objectives of this webinar are that by the end of the webinar, we hope that you'll understand the term social and emotional wellbeing in an Indigenous health context. We want you to be able to identify the online social and emotional wellbeing resources that you can find via the WellMob website. We hope that you can explain the difference between social and emotional wellbeing and mainstream mental health digital resources. And as much as anything else, we hope that you'll be able to apply those digital resources with your Indigenous clients and patients. Dave's already introduced himself. It's wonderful to have you here, Dave. Thank you for coming. And as well as Dave tonight on our panel, we have a GP, Dr. Anthony Vogelpol from the Sunshine Coast in Queensland. Anthony, tell us a little bit about yourself.
Well, I've had many years of experience in Indigenous health, mainly remote Indigenous health in the Cape, in Arnhem Land and the Gulf country. This year I've been back to the Sunshine Coast because of the COVID effect. I must say, in my years in Aboriginal health, the embracement of technology in remote communities is amazing. If they had a JB hi-fi shop in the community, they'd sell out in no time, or an Apple shop. So, I think the technology's there. The Wi-Fi experience is poor, but, they're ready to embrace stuff like the WellMob site.
Thanks, Anthony. And we also have Simon Dubois, who comes from Byron Bay. He's a psychologist at the Health Lodge in Byron Bay. Simon, what's your interest in the subject matter of this webinar?
Well, my interest is certainly in digital technologies and mental health, and that kicked off back in 2007 as a youth worker when the iPhone appeared. And at that same time, MySpace was starting to raise itself as a feature in our community. So it was really behove of me to understand and really just had an interest in these digital technologies, and then seeing how they applied themselves in our work as social workers, community workers and counsellors.
So it sounds like you were a bit of an early adopter, Simon.
Yeah, I was sort of like a late early adopter. My kids helped me.
All our kids have helped us, don't you worry.
Right.
So in this webinar, we're going to talk about social and emotional wellbeing resources, the new WellMob website. We might talk about the WellMob website ad nauseum, but you'll understand why when you see something of it. And you will hopefully hear from these experts about how to use these resources in your own practice. There's that QR code again, if you'd like to use it. Otherwise, copy the URL from the slide and paste it in your search engine in order to find the site where the resources can be found. If all else fails, at the end of the webinar, you'll get my email address. If you jot it down, you can email me and I'll send you the resources. So it's not the end of the world if you can't get the technology right. Let's first of all have a look at a video. I'm hoping you'll be able to see this video because it is a wonderful example of an Indigenous person with a chronic mental health problem who has turned a negative, what is likely to have been a negative in his life, into something more positive. This is Joe Williams. He'll tell you all about himself, but I need to tell you that the video comes from the Indigenous Suicide Prevention and Wellbeing program called The Enemy Within. You can get to this video from the WellMob site or through Joe Williams' own website. Here we go.
My name's Joe Williams. I'm a First Nations Wiradjuri man from Australia, and I've lived as a professional sports person for the past 15 years, been involved in sport my entire life, and lived with mental illness my entire life. I guess I only really knew it was mental illness in 2009 when I was diagnosed, but I lived with an inner dialogue in my head my entire life. I knew that was going to end poorly. So I decided to give away alcohol and drugs and anything that come with it. It's almost 11 years that I've been completely clean and sober now, but by taking out the substances that I was putting to quieten down the noise, upturns the volume on the noise. So I had to, I guess, learn about what I was going through, and learning about what I was going through started to learn about myself, but also educate me about the mental illness I was diagnosed with, and that was bipolar disorder.
If you go onto the website and watch the rest of Joe's video, you'll see one of the things that he's most keen on is cultural connection in terms of his recovery. So it's really worth going and having a look at the rest of that video. Dave, I'd like you to tell us what the digital social and emotional wellbeing resources are. What are we talking about here?
Well, thanks, Jan. And I think the video there from Brother Joe Williams is a great example. It's a story-based resource that is talking about a person's journey, and I find it very empowering. And I know a lot of Indigenous people find it empowering to see people like Joe up there talk about the challenges he faces in his life and how he overcomes it. And as you rightly mentioned, culture is a big part of that. And I think that's one of the points we'll try and make. That is a key difference between Indigenous wellbeing and non-Indigenous wellbeing for our non-Indigenous Australians. But yeah, before we go on and talk about this new WellMob website, which is a repository of all these digital resources, let's just get on the same page and make sure we know what we're talking about when we mention digital social emotional wellbeing resources. So most people are probably familiar with some of the clinical or evidence-based resources that are out there, such as apps, websites, and online programs. And I've got a couple of examples there. With an app, we've got the iBobbly app, which is I guess an app for Indigenous people to self-manage their wellbeing. Check it out if you've got a chance. It's been developed by Black Dog Institute with a lot of involvement of Indigenous clients, particularly in WA. Websites and portals. Portal's just a flash name for a website that links to other websites and other resources, and that's exactly what the WellMob website is when we mention that shortly. But Gaia Dewey is the one that I've got up there on the right hand of your screen, which is part of the Proud Spirit Australia agreement, but also a website that's been funded by government to be I guess a bank of community-specific educational and health promotion resources around the COVID pandemic. So that's a great one for clinicians to look at printable resources for their practices and their clients around the COVID pandemic. Online programs, I might just mention one like MindSpot, which has an Indigenous-specific wellbeing program. That's an 8-week program for Indigenous people 18 years and up. I guess the other resources we really want to focus on, and particularly that is a real, I think, positive of the WellMob website, is some of those more informal online materials or grey materials, you might say, that are based on their evidence of, around, clinically proven that they help wellbeing. They're the sort of materials that you wouldn't quite think of in the mental health and wellbeing space, or particularly working with your clients. And we're talking about video and social media and audio content. And I think the real important thing about using this type of informal content is that it really speaks to Indigenous people. A lot of the video and audio and social media content is narrative based. So, we've got a strong tradition of oral culture. So we pass on knowledge through story, and hearing other people's story is really an important way for us to understand the nuances and messages, particularly around well-being. And also, as Anthony mentioned, we're pretty quick on the uptake for technology. Like, we've gone from using spears and nets to using firearms and four-wheel drives and boats to catch our prey. And it's no different when it comes to using resources for our well-being. Our culture is still strong, and we still practice that out in the bush, but we also look at resources online that can help us in our everyday connection to country and culture. The only other informal resource I might mention is just things like PDF fact sheets and posters that, often are very pictorial. And the big difference with video, audio, and pictorial resources is in a lot of our communities where, through educational disadvantage, literacy rates are substantially lower than our non-Indigenous Australians. And I think those types of resources are really important to get across health messages without having the barrier of language, particularly when a lot of our remote communities, English might be a second or third language. So it's really important to think about resources in language as well as resources that are written in plain language.
I love digital resources, and before the WellMob site has done any recent, so I used to download all the local DVDs and videos I could find and convert them, put on iPads. Most clinics have a number of iPads that we use in the waiting room, or we use them as distracting tools for RHD, rheumatic heart needles, and just conversation initiating devices. So yeah, I love it. I use it a lot.
So you're on the 3-4 team. And Simon,
I'm
I guess you're a 4. What are you, Simon?
Yeah.
Are you a 3 or a 4?
I like to use them frequently, and I encourage myself to, but it's interesting because sometimes it just sort of falls out of my practice and I have to remind myself and retool myself. So it's something you have to keep jogging yourself along. So I'm aspirational often or always, but sometimes I fall into occasionally.
So we'll find out later how you both do it. Right now, we're going to have a little audio grab from someone called Candace Angelo, who I believe, David, is a colleague of yours.
Yeah, Candace actually is a registered nurse in a North Coast hospital and head of the nursing department in ED, but she's also a lecturer at University of Sydney for the graduate diploma in Indigenous health promotion.
Let's have a listen then to what she has to say.
Hi everyone, my name is Candace Angelo. I am a Yuin woman, proud to be working and living in beautiful Yagal country in northern New South Wales. I work as a registered nurse in a rural and remote hospital and often come into contact with youth, young patients who are in distress. So a service that I like to use and refer to my young patients is an app on my iPhone called Check-In. This app's been developed by Beyond Blue, and what it does is it has two purposes. The first one is to point you in the direction of places to go to get support. So there are contact details on there for Lifeline, for Kids Helpline, for Headspace, for eHeadspace, for Reach Out, and for Beyond Blue. Not only that, but it also allows you to have a conversation planner. So this is something where if you're really worried about a friend or a family member but don't know how to talk about social and emotional wellbeing issues with them, it takes you through the 4 steps to plan your conversation so that you feel more confident and comfortable in having those hard conversations.
I might add too that Check-In is not an Indigenous specific app. It's something that we can use with lots of our patients and clients. So I would recommend that you download it and have a look at it. It is, of course, free of charge, and I think you might find it could be useful for you. But it's really nice that we know from that little grab just exactly how Candace uses that app in her practice. Dave, tell us about social and emotional wellbeing and what all that means.
Yeah, thanks, Jan. We thought before we talk about more digital wellbeing resources and the new WellMob website that holds these resources, that we just explore a little bit the concept of Indigenous wellbeing and unpack that a little. I guess it's a really holistic concept, and one way to sort of describe it is this little diagram that's on the right-hand side of your screen, which was a model of Indigenous wellbeing, which was put together by Guy Dudgeon and other authors. And it might not appear great on your screen, but it will be in one of the resources on the resource list that you can download, so you can check it out in a bit more detail. But I'll just run through it because it really captures the holistic and interrelated sense of Indigenous wellbeing. And my colleague there, Simon, and I had a yarn about it, and he really likens the model to a wheel, with the centre of the wheel, or the hub, being holistic social emotional wellbeing, and then the spokes radiating out from that wheel are all the factors that contribute to Indigenous wellbeing, our connection to our physical and mental health, but also our connection to country, culture, kin, community. And all those factors of our well-being are influenced by cultural, social, political and economic determinants that continue to shape how our well-being is in today's world. But it's very important to also acknowledge that the historical events and policies of this country since European invasion, and that period of dispossession and the subsequent policies of assimilation and segregation, and now attempts at reconciliation, have all influenced our ancestors and our generations before, and continue to play out in various forms of intergenerational trauma. And some examples of that of late that are quite topical are the stolen wages cases, where Aboriginal people, up until the mid-1900s, were paid into a trust fund and weren't actually given money. It was held by the government, and they were often paid in tobacco and alcohol, which today, can often play out in higher incidents of substance misuse. Other examples, such as our stolen generations, some of those events continued right up until the 70s and still happen through the policies of today with child protection laws and Aboriginal communities. So it's really important to understand that Indigenous social emotional wellbeing is holistic and is shaped by these historical and ongoing events that happen and that still control a lot of our lives. And there's a great video we'll show shortly, which I think captures some of the essence of that. But before I do, I just want to really finish off on the point that the big distinction between Indigenous mental health and wellbeing versus the wellbeing of our non-Indigenous Australians is that connection to culture, country and community, and that mental health is just one component. So I'll leave you with that thought while we have a look at this somewhat provoking video that looks at our history and was put together by the Western Australian Department of Health with Tim Muirhead and Danny Ford as the creators.
Imagine a line of well-being. You have ups and downs, and that's normal. Before colonisation, Aboriginal people also had their ups and downs, but overall our spirit was strong. Aboriginal people had a strong culture for tens of thousands of years. When the dominant culture arrived and they took over our land without our permission, the process of dispossession began. The loss of land and disruption to our way of life, ignoring the things most sacred to our culture, including our family kinship systems, language, traditional law, cultural practices and looking after country. The dispossession brought massacres, poisoning and disease. We lost our freedom, physical safety and health, all of which impacted on our well-being. They introduced legislation and policies to assimilate us, with the ultimate aim to breed Aboriginal people out of existence. They even took our children from us.
So, I think that always requires a little pause after watching something like that. I find it very disturbing. Why do we need WellMob? Dave?
Thanks, Jan. Well, that video is a bit thought-provoking, and it's really important to do some truth-telling when we're running webinars such as this, and that we're hopefully looking at some of the strength-based narrative resources that are out there also that keep us connected with our culture and help our healing through being in touch with our community and culture. But it's a bit of a segue also to the need for a more holistic website that's based on this model of social emotional wellbeing for Indigenous people. And the idea for this website, which we've called WellMob, and that was launched in July this year and was developed in collaboration with the Australian Indigenous Health Infonet, came from actually frontline Indigenous workers. And the idea was that we needed more than just mental health based resources. Like a lot of the mainstream mental health websites are great, but they're really for mental health workers, and they're really specifically just for mental health issues, whether that's anxiety, depression, etc. The workers really felt like they needed something more holistic that tapped into things that keep us strong, and that, as I mentioned before, the importance of culture plays out there. They also, our workforce also said we needed resources that were easily accessible, culturally safe, had been vetted. We know there's a lot of material out there on YouTube, and that can be quite triggering, and it's quite concerning that our young people have a lot of access to videos that may not be the best messages to do with our health and well-being, and that may actually reinvigorate stereotypes about Aboriginal and Torres Strait Islander people. So our workers out there said really needed something that showed some of our strength-based resources around language, our music, our songs, our dance, and our stories, which helps us keep us strong, as we saw before in that holistic Indigenous wellbeing model. And finally, the workforce said trying to find culturally relevant and appropriate wellbeing resources was like finding needles in haystacks. It was extremely difficult to find Australian Indigenous content by doing a Google search, and I'm sure everybody would have that experience where they put in the Google search engine a particular topic around Aboriginal health, and often the rats and stats you might get aren't the really positive resources that you might use with an Indigenous client, but are more probably empirical data. So they're the reasons why we've come up with this new wellbeing website called WellMob. So in a nutshell, it's a one-stop shop of Indigenous wellbeing resources. It's for our frontline workers, and that includes GPs and allied health. And we really try and promote the benefits of this website for our non-Indigenous clinicians out there, because they can go to this trusted source that has a repository of all sorts of wellbeing resources, and it gives them a great talking point with their client. And our panelists will talk more about that shortly. And finally, before I hand it over to our panelists, I just want to acknowledge the partnership between our electronic mental health and practice and the Australian Indigenous Health Infonet in developing this resource. But I would really like to stress that our Indigenous reference groups of workers were the ones that were really behind the look and the feel and the function of this website. So a big shout out to them.
Let's actually have a look at the website. We've got a video, Shani Roberts, of one of Dave's colleagues, I believe Dave, is going to pop in and show us what the website looks like and how to use it.
So let's explore the WellMob website together by simply searching www.wellmob.org.au. As you can see, the WellMob home landing page has a simple layout and is culturally inviting, with Aboriginal artwork by Aboriginal artist Frances Bell Parker, a descendant of the Yagal people. WellMob has normal features that includes the About tab, contact links, Get Help When in Crisis link, and a search function. The main feature of WellMob is its app-like appearance, with 6 icons representing 6 main topics that you can find wellbeing resources under. These are mind, body, our mob, culture, keeping safe, and healing. You notice that the website is based on a holistic model of Indigenous social and emotional wellbeing, and captures many of different things that make up our health and wellbeing, not just mental health. The website is designed to find resources within just 3 clicks. For example, if I click on Mind, it takes you to the subtopic page. On the subtopic page, you'll find a range of issues that are related to keeping a healthy and strong mind. And when I click on a subtopic such as worries, I'm directed straight to a page with multiple resources under worries. On the left-hand side here, I'm able to filter my search by the condition type, language, resource type, such as videos, websites, audio, apps, even documents. Target audience and age groups. If I click on a resource, I'll arrive at the resource. Whether it's a website, app, video, podcast, you'll see on the left-hand side here that there are descriptors in plain language, such as what it is, who's it for, where's it from, which gives me a good indication about what the resource is about. And if I click on the link, it opens up the resource on this same page for me. To further explore, click on www.wellmob.org.au. Thank you for tuning in.
It's great to see that resource in action, Dave.
Yeah, it is. That's a great demonstration from Shani Roberts, our team worker and local Widgeable Wyville woman and social worker. So I thought I'd just sum up, Jan, before moving on to our panellists. And I guess the real take-home message for this webinar is two things. It's about WellMob is there to look for resources for your Indigenous clients and share them with them, as well as it's also there for your professional development and to support your work. So in sharing the digital resources, I guess it's a simple process of sitting down with your client or patient, talking about an issue, searching the WellMob website for a resource on that issue, looking at it in session, or sending it via email or writing it down on a card that they can use and integrate it in their practice or the wellbeing practice out of session. And secondly, with supporting your work and your professional development, there's some really good cultural awareness resources there. And we've seen a snippet of a video there before around, I guess, the truth-telling of Australia's history and how that maybe impacts on our Indigenous health and wellbeing today. And we'll see another short video at the end around that. But also there's some great resources for our Indigenous workers out there to practice self-care. So if you looked at the training resources tab of WellMob, hopefully there's something for everyone.
So let's get practical with all this and ask Simon. Simon, how do you bring this subject up? I mean, it doesn't come naturally to either practitioners or patients and clients to think about using digital resources. How do you go about doing it in your practice?
Yeah, it sounds like a simple thing to do, Jan, but when you get behind this process, you've got to be a bit organised. You need to have your technology ready and organised, whether it's your phone or you've got to have your iPad ready to go sitting in your office. And so when the opportunity comes up, you're there and ready to show them something. So, I mean, the long and the short of it, you want to say, hey, I've got some digital resources that I'd like you to have a look at. I'd like you to have a look at these things because they'd really help. When you look at those previous resources that we just went through earlier in this presentation, they're really interesting. There was one where somebody is showing how they were reflecting and thinking about their mental health condition, a great way to introduce somebody to that process themselves. Or if somebody's trying to understand their own experiences with trauma, being able to put it in a historical perspective. But to do that in the moment, if you're a GP, you might have 15 minutes. If you're lucky, 20. If you're an allied health professional, even that 50 minutes seems like a really short period of time. So again, it's about being really organised, knowing your resources so that as soon as you get that opportunity, you can see where it fits. And again, that's where WellMob's really, really good because they've been put in a place for you where you can access them quickly. All it requires of us is just to go through that stuff and get familiar with it. So that, again, when there's a good moment, you can jump on it and kind of seize the moment. So before we start thinking about these resources and getting overexcited about it, we just need to take a step back for a moment and have a think about, well, what are the sorts of technologies that are available to the person in front of me? We need to be careful about making assumptions that everybody has access to limitless amounts of data or they have the sort of technology that's available to us. So we need to, in that short period of time, just check in and ask and find out. It's very risky to make assumptions like that, particularly when people are living in much lower socioeconomic circumstances. So that's an important thing to do. If we've got the time, a really great way to support this conversation is to actually ask the person how they're using technologies in their own life. I mean, for me, when it was working with young people, I could kick up a really good conversation about what they did in terms of gaming or where they were at in social media. And if I knew a young person was using Facebook a lot, I knew there was an opportunity to infect their feed with Beyond Blue or Black Dog Institute. All these places have great messages that they're sending out all the time. So we're looking for the opportunities where a person's interests already sits or the technology that they already have.
I'm not sure I know how to infect someone's Facebook feed, Simon. I'll talk to you about that later. I know you wanted to talk to us about the Stay Strong app, which is a particularly exciting app for those working in Indigenous mental health. Tell us something about that.
I do want to talk about the Stay Strong app because this is an example of a piece of digital mental health technology which really embraces the idea of cultural consideration, cultural appropriateness and cultural context. And David's really been emphasising this point, which is super, super important. So this is something that allows us to move into that cultural space really fluidly and work in a really interesting way and, again, culturally orientated way. So we're going to have a look at a couple of pages that are associated with the Stay Strong app. And for GPs out there, counsellors, psychologists who are listening in, one of the ways to think about the Stay Strong app is like a really, really good assessment tool. It's a really good way to walk through somebody's experience and what they've come to seek, the sorts of help that they're seeking from you, and do that through this app. So you can see a couple of pages there which sources this information, and one of them you can see there is the people who keep me strong, and this is a way of identifying the support networks that a person has in their family or their community, and maybe the very thing that we can support that person to use in their own healing journey. We can see another page there called My Worries. And this is an opportunity to walk through the sorts of things that that person is struggling with and where they would like some help. And then there's the other page, Things That Keep Me Strong. The Stay Strong app is a strength-based model. And so we're really looking for, as you know, Jan, psychologists have a habit of looking for problems all the time, not looking for strengths. So this is a reminder for us to find the sorts of resources a person already has that we can take advantage of to support them in their healing journey. And you can see both of those pages incorporate the Stay Strong tree, which is a strong symbol of an emblem for Stay Strong. And finally, there's the opportunity through the goals section to really wrap that all up and have a meeting point where the clinician and the person can see how they're going on that journey.
It's worth mentioning that Stay Strong, the app, only works on tablets, not on phones. I think if you go looking in the App Store, you're not going to find it. You've got to go to the website, haven't you, to download it from the website. Is that correct, Simon?
The place that people can get stuck is on their phone. They're looking in, say, for example, they've got their iPhone and they go to the store and they are trying to download it onto their phone. Yes, it won't work. You need to do it through your tablet.
Mm-hmm. Okay, that's important. Thank you. And it costs $12, I believe.
Yeah, around that.
Yep.
Really worth checking out and having an explore and play with. And have a go with your colleagues, and then just having it available there in your room for that opportunity to use it.
Because it's meant for you to use in your room in collaboration with the patient, isn't it? It's not something that they go away and fill in.
That's right. And that's a general truth for most digital mental health technologies. They work best when they're done in collaboration with someone. So it's good to have the time to be able to do that.
Mm-hmm. Well, I hope that sparked some interest in our audience in doing their assessments using that particular tool. Let's move on to Anthony now and let him tell us exactly where digital resources fit into his practice as a GP.
First of all, I want to say the Stay Strong app, I have experienced it quite extensively, used by Aboriginal health workers and allied health, and it's an easy tool to use and really effective. So I'd really endorse that. I was going to tell you about, if you get the amazing experience of living and working in remote communities of Australia and to embrace the beautiful culture of Aboriginal people, it's an amazing experience. And anyone who hasn't done it, go out there. I want to tell you a story. When I first started up there, and it's hard as there's a big turnover of GPs and medical professionals and people. How do you connect to the local people? How do they think that you're not just another white good that's going to get tossed out once you got a little bit burnt out? So, to go, I was a keen photographer and I had lovely photos on my wall of skiing holidays and pictures of other parts of the world. But I had a picture of a simple tree near the barge landing. My God, that photo saved my life so many times, because I'd be sitting there and they'd just point to this tree and they go, barge landing, and I go, yeah. And then, but they just wanted to talk about this tree, and it got my the consultation going so many times. And then I learned the more pictures of that I put up, there was always something new to talk about. Water and that connection to country that David's talking about is something that, we might recognise the Eiffel Tower, but we don't recognise just a simple tree. It looks like any other tree to me, but to the local people, that's amazing. And I think when you're trying to engage with Aboriginal people as a non-Indigenous person, you don't really understand the culture like they do. Anything that can get that conversation flowing is great. So we would have iPads in our waiting rooms. There's always a lot of computers that sitting empty in the clinic, and we would give people, the family, an iPad and try and put it on something good that they need to look at. And then within a few minutes, they were exploring the iPad and looking at all the local content we put on there. And I think on the WellMob site, I've used the search engine and dialed in local community names and found resources that belong to that community. And that's really important to find resources that where they might identify with the local pictures or even the people that are on the local videos. So, and to have such an easy website to use that has already been pointed out is amazing, because that's quite a hard thing to do, to start looking for stuff. And it's safe, and it's been vetted before. And most of the videos are well done, well designed. This one, I think it's the grog story. I love the animated videos, but what I really saw a great lot of is local Aboriginal people are great hunters, and they cut up their animals and they open it up and dissect all the insides, and they eat most of the animal bits that I would never eat. And they really have a good understanding of anatomy, and when you use these simple diagrams of anatomy, and you see it all in the Aboriginal artwork, the X-ray type pictures of animals and people, and any video that's got some of that content has a lot of meaning. And I found it helped me save my life in when you're dealing with things you've never dealt with before, like petrol sniffing. How do you initiate a conversation when all these people are dragged into talk, and you're the doctor and you have to say, stop sniffing petrol? That really works. So if you've got a video you can refer to, and people can look at that, and then conversation starts to flow, and you really can achieve what you want to achieve in a consult rather than feeling like it was a pretty useless consult. Thanks.
Let's have a look. Thank you very much, Anthony. Let's have a look at one of these videos that Anthony is talking about. This is the grog brain story. Here we go.
It might look a little funny, but it is a very important part of who I am, how I think, act, and feel. Without a healthy brain, I couldn't do the things I like doing, like playing football, hanging out with my mates, listening to music, dancing, talking with my family, sharing my culture. This is because the brain has many different parts. Here are some of the main ones. This part is called the limbic system. It helps me look after my relationships. This one is the frontal lobe, and it helps me make decisions. This is the cerebellum. It controls how I move my body. This one is the hippocampus. It actually helps me remember things. And this one here, well, this is the pleasure center of the brain. It helps control how happy I am and how good I feel. Some things we do change the brain, like drinking too much grog. This can stop the brain working properly because drinking too much grog changes who we are. At first, when I give my brain grog, it can make me feel good. I feel strong and really happy. But after a while, I keep wanting more and more grog, but it doesn't make me feel good anymore. It's like I forget how to be happy without grog.
I think that's very cute, and I love the neuroanatomy lesson. Before we go on with the summing up, can I just answer Bronwyn's question about perinatal and infant mental health resources that you'll see in the chat box? Whilst Judy can't remember what's available through WellMob, I can tell you that there is another portal, though it's not Indigenous specific, there is another portal that exists to a whole raft of perinatal resources, and that's called Mum Space. Just note that down, and if somebody can put the URL in the chat box, that would be great. Mum Space is from the same stable as WellMob, and it deals entirely with perinatal mental health resources. So, Dave, give us a bit of a summary of what we've been seeing here.
Thanks, Jan. It's been great to share this webinar with everyone exploring the new WellMob website. We're really excited about it, and to hear about some of the tips and tricks of using digital resources. So to sum up, I guess we've covered that Indigenous wellbeing is a holistic concept, and that's the concept that we've developed the WellMob website on. It is more than just mental health. And certainly the connection to the positive narrative materials that are on there, including video, podcasts and social media sites, is an important resource for you to share with your clients. And I really appreciate that we've been able to hear about from our clinicians, Simon and Anthony, some practical examples of how they start up a conversation with a client using a digital resource and how they've been able to integrate digital wellbeing resources with their Indigenous clients. So I hope everyone's got something out of it.
Indeed, something that you can go to work tomorrow and use with your Indigenous and maybe even your non-Indigenous clients. Let's have a look at another video. I know you never get sick of watching videos. Let's have a look at this one. Why is this one here, Dave?
Listen, this was just a finisher, I guess, to try and focus on that bigger, more holistic picture of Indigenous wellbeing. And it's from the Healing Foundation. And it's got Uncle Jack Charles doing the narrative. Everyone's probably familiar with Uncle Jack Charles, or if you're not, you will be when you hear his voice. He's a famous Indigenous actor and activist.
In the time when our story started, we were able to parent in the cultural way that has seen our families survive and thrive for generations. Our people were strong, and our culture flowed and healed us in times of hurt.
But since the trauma of colonisation and the stolen generations, we have not been able to heal in the same way. And we have unknowingly passed this trauma on to our children through sharing our sad stories and having them witness and experience our pain. This is known as intergenerational trauma, and we see symptoms today in broken relationships, disconnected families, violence, suicide, and drug and alcohol abuse.
But this is not where our story ends. We still have strong minds and hearts, and we still know who we were and where we belong. By creating safe and strong communities together, supporting our families to be free from pain, returning to our culture and building a strength of identity, we can stop the cycle of trauma and bring about positive intergenerational change, so that we can continue to thrive for the next 60,000 years. There are simple things that we can all do to help heal our trauma.
Visit healingfoundation.org.au to find out more.
Am I the only one in the room that feels like going and hugging that man when you hear his voice? He's got such a lovely voice, hasn't he? Tell us about WellMob cards, Dave, just as a postscript.
Yeah, thanks, Jan. Just to finish off, we thought a great practical tool for you clinicians out there is like a little postcard-sized calling card that you could write on the back some URLs or website names or resource names for your Indigenous clients. So if you would like to receive them free of charge, my email address will appear next. And a big shout out to Taylor Laurie, one of our team members who designed the artwork on that card, as well as manages our Facebook page. So please follow us at WellMob on Facebook.
And there's the URL for WellMob, which you've already seen numerous times as we've gone through the webinar. And there's Dave's email address if you'd like to contact him. On the next slide is my email address if you think that I might be able to answer any questions that you have or help you in any way. And I'd also like to recommend that you go and have a look at the Black Dog Institute's MPRAC page on our website. That's a page full of information and links to webinars like this one, podcasts, etc., about e-mental health and the use of digital resources in mental health care. I know it looks like I'm winding up. Hang in there, though. There's an excellent video that comes just after this slide. I just want to remind you to please don't forget to fill in your feedback forms at the end of the webinar. So there'll be the video and then the feedback form. And at this point, I'd like to very much thank everybody who's been involved in the production of this webinar, particularly our live performers tonight, Dave, Simon, and Anthony. And all of you for being here tonight. It's been wonderful to have you. There's that QR code and the URL to the resources, or email me if you'd like to get the resources by email. And I just want to take you to this final wonderful video. Do you want to say anything about it before we play it, Dave?
Jen, I just thought I'd give a bit of a shout out to another webinar of very similar content, but with a very different panel, an all Indigenous panel next Thursday at 1 p.m. through the Medcast platform and through the e-mental health and practice Black Dog Institute webinar series. So please tune in, and it's particularly for our frontline workers and particularly our Indigenous workers. So if you've got any Indigenous workers in your team you'd like to share that webinar registration with, please forward it on.
You can find the link to that webinar exactly where you found the link to this webinar. Let's have our special treat for the end of the webinar.
To know me is to breathe with me. To breathe with me is to listen deeply. To listen deeply is to connect. It's a sound, the sound of deep calling to deep. Dadidi, the deep inner spring inside us. We call on it, and it calls on us.